Cephalosporins are a class of beta-lactam antibiotics, derived from acremonium, previously known as cephalosporium. They are structurally and functionally similar to penicillins, but they have a broader spectrum of activity and greater resistance to beta-lactamases. They are classified into 5 generations based on their antimicrobial spectrum. To memorize the 5 generations of cephalosporins, imagine an apartment with 5 rooms, each representing a different generation. Each room contains visual cues related to the key drugs and bacterial coverage of that generation, making recall easier and more structured. You step into the first-generation cephalosporin room, and right away, you hear the screeching sound of a violin. At the center of the room, Alexander the Great, for cephalexin, is playing terribly on a violin, for cefazolin. His playing is so awful that the neighbors are furious. To the left, a protesting man, for Proteus mirabilis, is holding up a sign demanding silence. Next to her, another woman, furious and gripping a club, for Klebsiella, looks ready to attack the musician. In the corner, a surgeon, for surgical prophylaxis, stands calmly, seemingly unfazed. He's holding a cooler labeled E. coli, which he seems to be using for preservation. The tension in the room is thick, but the imagery makes it unforgettable. Next is the mysterious tea room, for second-generation cephalosporins. Picture an elegant, dimly lit tea room with a large wooden table at its center. A well-dressed lady sits gracefully, wrapped in a luxurious fur coat, for cefuroxime. She delicately nibbles on a pretzel, for cefprozil, while holding an teacup, for cefotetin. By the table beside her, a clever fox, for cefoxidin, sits, watching intently. Above, a majestic painting of a falcon, for cephachlor, hangs in a golden frame. Now, let's examine the bacterial invaders hidden in the room. In the painting, the falcon's nest represents Neisseria. Against the wall, a serrated saw, for Serratia stained with blood, for Haemophilus, is pictured. An aquarium filled with murky water holds a strange bacterium swimming inside, represents anaerobic bacteroids. Near the door, an entryway sign reads Entero, for Enterobacter, marking its symbolic presence. This surreal yet structured scene makes it easier to recall both the second-generation cephalosporins and their bacterial coverage in a fun and memorable way. The next room is a classroom where you're about to take an exam, representing cephixime. The room is filled with giant textbooks that seem taxing to read, reminding you of cefotaxime. There's a shiny dime on the desk, which nods to ceftazidime and its significance. Your friend sitting on the very next bench is really thinking deep. It seems he is trying to remember some tricks which he used during his studies. He might not remember those, but these tricks will surely remind us of ceftriaxone. There is also a picture of Mona Lisa on wall to represent Pseudomonas, since ceftazidime treats Pseudomonas. As you pick up the pen to begin your exam, suddenly a gong rings loudly, filling the room with sound. The gong's deep tone symbolizes the urgency of gonorrhea, signaling that something serious needs your attention. You glance to the side and notice your friend tapping their head with a pen, as if in deep thought. This makes you think of meningitis and how it affects the brain. Their tapping becomes rhythmic and almost hypnotic, reminding you of the importance of paying attention to neurological symptoms. Just then, lemon juice splashes onto the desk from a small bottle, and you instinctively feel the sourness on your tongue, a sharp contrast to the rest of the scene. The lemon juice is a symbol of Lyme disease, reminding you that it can sneak up unexpectedly, just like the sting of a tick bite. You glance back at your exam sheet, and as you start writing, you can't help but feel that all these elements are interconnected: the urgency of the gong, the trick of the pen tapping, the deep focus of the Mona Lisa on the dime, and the sharpness of the lemon juice. They're all reminders of how crucial it is to recognize and treat these serious infections. The fourth room represents fourth-generation cephalosporins. This room seems like a ward room. In this room, a girl is sipping a pine juice. The phrase "sip from pine" sounds like cefepime, isn't it? Okay then, there is a Roman pirate, for cephpyrome, since pyrome sounds like pirate of Rome. The girl is in a hospital bed, to indicate that these drugs treat hospital-acquired or nosocomial infections. Lastly, there is a painting of Mona Lisa, which stands for Pseudomonas, which cefepime covers. Next is a hospital room dedicated to fifth-generation cephalosporins. The room is a blend of clinical and artistic elements. A young girl, around 10 years old, sits in a chair, her arm resting on the table with a blood pressure cuff rolled up around it. The rolled BP cuff kinda sounds like ceftobiprole, isn't it? Alright. She is so deeply focused on a painting she has made. The painting features a Mars rover moving along a road with a tar line, symbolizing MRSA, Mars rover, and ceftaroline, tar line. Cephalosporins are generally well-tolerated antibiotics, however, they may cause adverse effects ranging from mild to severe. To effectively retain the adverse effects of cephalosporins, visualize the exit gate of the apartment with distinct symbolic representations. At the exit gate, two large pencils form an X shape, symbolizing the cross-reactivity between cephalosporins and penicillins. This highlights the potential risk of allergic reactions in penicillin-sensitive individuals. Scattered on the ground near the gate are empty beer bottles, representing the disulfiram-like reaction that occurs when alcohol is consumed with certain cephalosporins. This reaction manifests as flushing, nausea, vomiting, and tachycardia. Leaning against the exit door is an ill, intoxicated individual, visibly nauseous and vomiting, with a rash on their skin. This individual symbolizes the nonspecific side effects of cephalosporins, such as gastrointestinal disturbances, nausea, vomiting, diarrhea, and hypersensitivity reactions.